Misty, do you have okay. Sorry.
to be available as we go tomorrow and then going forward. Um, a couple of things just in terms of the process that we're going to follow. I recognize that there will be some 70H advocates that will be a part of this discussion. There is no way that I can imagine that I'm going to persuade them that our position is correct any more than I don't think they can persuade me that their position is correct. I think generally there is some common ground between our positions, but there's some fundamentals that simply don't work. And generally speaking, it's whether you attribute the causation to the problem that we're currently experiencing to the decision that was made by the 7OH manufacturers in 2021, and then more significantly in 2023 when they made their big market splash to ignore the federal requirements for having to document with a reasonable basis of safety for the under conditions of use or labeling for their products. And they ignored those. There's no question about that. It's not disputed. The 7OH manufacturers themselves acknowledge it, and that's just a fact. And that's why we're in this position today, because had they gone through the process that's prescribed under the DSHEA Act, the Dietary Supplement Health and Education Act, and the FD&C Act, the Food, Drug, and Cosmetic Act, they would be on the market if they could meet those conditions, but they couldn't, and they didn't, and so here we are. The other side of this argument is, what about the people that are now 7OH consumers that are trapped into the level of addiction that comes with the consumption of these 7OH products because they are chemically manipulated opioids? And are we going to leave you high and dry? And of course, that's the inevitable outcome when you have the kinds of issues that are present with the highly addictive substance that's on the marketplace, and there's no basis for safety for them being there. And yet, you have a situation where if you ban 7OH, which the government is, and we'll discuss this in a minute, is likely to do, then you don't have any options or alternatives. And somehow that becomes a point of contention where the blame is laid at the feet of those who have advocated for this ban, which includes the American Kratom Association. We readily acknowledge that. And I think that the only reasonable argument I can make is that if we have a drug peddler that's down on the street corner peddling fentanyl and the police arrest him, what about his customers? Where do they go? Because it is a highly addictive, potentially dangerous product for the purpose for which the arrest was made. We don't suddenly allow that person to just go down to the next corner and not arrest the next drug peddler. And that's pretty much akin to the argument that we have now with respect to how the DEA is going to handle this. So I recognize that there's a difference of opinion on this, and I know that they're strongly held. I get it. I have seen repeated comments being made on some of the social media channels, including X and LinkedIn, where I'm called a murderer and the blood is on my hands, and all of the other kinds of negative things that can be said because we take a policy position that we believe is well grounded in the law. And that's the situation. We're not going to be able to agree on those factors. So I would encourage people that as we get through this process and have this discussion, that there's no good outcome that can, if we're going to be name calling and having this kind of a highly charged emotional argument. It's not productive. It's not going to change the way it is. But I will describe at least as much as I know and what I would predict is going to happen just based on experience in working with these kinds of scheduling recommendations that have been made in the past and how they're likely to play out going forward. So we'll start with that. And just as a sort of the ground rules here, if you have a particular question, I'm going to talk in segments here first about the federal scheduling situation, and then we'll pause and you can ask questions by raising your hand. We'll limit in each segment those questions to probably 4 or 5 people. And then at the end, if there are other questions remaining, we'll do the best we can to answer. I've had some criticism that this goes on and on and on, and I don't want that to be a disincentive for people to join these webinars going forward. So, to kick this off, obviously, the most important issue of the day is that the issue about federal scheduling. Uh, Today would have been the first day that the Drug Enforcement Administration would have been permitted to publish their final rule on the two scheduling recommendations that they made. One was for the scheduling of 7OH above a certain threshold that they had established in the scheduling order. And the second was a scheduling recommendation for metrogenine, pseudodoxil, and MGM 15 and 16 products. And so the DEA did not determine that today was the appropriate day to finalize those rules. They can do so at any point beyond today. We are hearing very strong indications that they expect to do so by Friday of this week, but there's nothing solid about this. There's no credible information that's available other than from the administrator himself to say this is when we're going to publish, and he has chosen not to disclose that. And by the way, all of that is intentional in the sense that the DEA does not publish or publicly discuss their scheduling recommendations. And that's, of course, something that they try to keep in their black box. And it really, I think, is designed to limit the kind of external influences that people may attempt to make if they knew in advance that something was going to happen. So I think that anything that we can provide to you is nothing more than a guess that it may be done by the end of this week, but it would not be surprising if that was delayed for whatever reason. One thing that might impact their decision is that in an unusual proceeding, the Assistant Secretary for Health did open a comment period about whether or not there was scientific evidence that was available that would inform HHS in making a follow-on recommendation to the Drug Enforcement Administration on the level of 7OH. That comment period ended at the end of July. It was unfortunately abused by some advocates who decided that it was, in fact, a comment period for consumers who were using 7OH to provide their testimonials. That was not the purpose of it, notwithstanding what you might have been told by the 7OH advocacy groups. It simply was a futile effort because the Department of Health and Human Services has a very sophisticated screening using AI tools where they screen out any comments that are not relevant to the specific purpose for which the comment period was opened. And I think anyone who's looked at the comment page will see that there was a huge spike in the last 48 hours where it went to over 600,000 comments. And the best determination that has been made by the department is that they think that this was a AI bot attack that was made on the site. It's not necessarily, by the way, something that anyone did from either the 7OH advocates or the Kratom advocates, because this sometimes happens in other comment periods on these federal sites. But they will screen out those automated bot kind of comments, and they'll slow them down a little bit, obviously, but they will eventually get to the core group of comments that they think are relevant, which are only going to be those comments that speak to the level of 7OH and have scientific information that recommends either a different level or that supports the current level that's in there. And so, for better or worse, that's the situation that we are in. And the comment period may have slowed down the DEA's decision a little bit, and maybe by a week or two, if they decide that there is if there's a preliminary analysis done based on their review of those acceptable comments that might inform the DEA on the level of 7OH. So there's that. The other, and I think this is the far more important issue, is that the Department of Health and Human Services, the FDA, and DEA are saying that they are holding firm to their commitment that these scheduling recommendations will not impact natural kratom leaf products. And while there is a controversy that's arisen about whether or not metrogene pseudodoxil levels need to mirror what the 7-OH levels were at a minimum. And we at AK are among those because of the concern that's been raised. The DEA has remained firm that they are not required to do that because they have already articulated that it is their intent to only cover the naturally occurring, that they are going to protect the naturally occurring levels of any of the metabolites or alkaloids in the plant. And 7-OH was only listed because it is at a quantifiable level. It is, whether correct or not, the DEA's position that the quantifiable levels of metrogene pseudodoxil require far more sophisticated equipment than typically would be used in any testing methodologies that are done. And then it would require a validated testing method in order to make that determination. Our argument has been that the concern we have is that you will have some overly enterprising or aggressive governor or attorney general who will decide that they're going to make their own interpretation of that. But the DEA personnel claim that they're not going to allow that to happen. It's not their interest in doing so. I hope that there has been enough comment to the DEA that they will reconsider that position and that they will provide a similar carve out to the as they did for 7-OH to metrogene pseudodoxil. But again, the strong pushback from the DA was not, we don't have anything to worry about because, and this is true, the FDA commissioner, the secretary of the Department of Health and Human Services, and the DEA administrator themselves all publicly stated in a press release as they announced the scheduling recommendation that the intent of the scheduling is not to have an impact on natural kratom leaf products. And so that, of course, forms a very good predicate for us to defend in any kind of litigation that might ensue after that. And we may be the ones at the AK to initiate that in order to bring clarification to this issue. It is also true that to the extent that this issue does not play out the way that the DEA anticipates that it will, that in fact there will be an opportunity through legislation to also modify the rule because there are only two ways that a substance can get scheduled, and that's through the process that's initiated under the Controlled Substances Act or legislatively. And the DEA can always modify a scheduling rule, and the Congress can also do the same thing. So it's not like we're left high and dry if the scheduling recommendation results in an incorrect outcome going forward. So just so everyone is aware that it's not the end of the earth that's going to happen. I know that there are many people who subscribe to the theory that are in the 7-OH community that if 7-OH is scheduled, then inevitably kratom is next. And the truth is that the only way that that could happen is if there is a scientific basis in order for kratom or metrogenine in its natural form would meet the criteria that is required by the Controlled Substances Act, which is characterized as an eight-factor analysis. And there have been repeated eight-factor analyses done, including two in the United States. There was a third eight-factor done that was submitted to the Drug Enforcement Administration that looked at the difference between natural kratom leaf and 7-OH. There have been internal eight-factor analyses completed both by the FDA and the DEA, and all of them to date have concluded that natural kratom leaf does not meet the criteria and there cannot for scheduling, and there cannot be better evidence than that than the announcement by the National Institutes on Health, where they indicated they are going to undertake an investigational new drug application for the utilization of purified metrogenine, which means a highly purified metrogenine compound to use in opioid use disorder. And that study will take probably 2 to 3 years, after which there will have to be a submission, if there is a pursuit of this, to the FDA as a new drug application. And likely the NIH would be looking for a partner in the pharma space in order to do that. But that purified metrogenine does not mirror in any way the commercially available kratom products that are on the marketplace today. So there would not be any exclusion of natural kratom leaf products for the introduction of a new drug application under what's called the race to market provision of the Food and Drug and Cosmetic Act and the DSHEA Act. So people that are saying that this inevitably will lead to a ban because of it becoming a pharmaceutical grade product simply don't understand the way that the law works and its application thereof. And there's also some who believe that the inevitable fall of natural kratom leaf products will be attributable to the fact that the under the Drug Analog Act, and there is a very complicated testing methodology that goes through in at least three prongs of the Analog Act, of which natural kratom leaf would fail. And so there's not much of a legal standard there either. So nothing is ever absolute in the world of politics nor in the legal world, but there is certainly a high buffer of safety with respect to the continued existence of natural kratom leaf products that will remain on the marketplace because they do not meet the criteria for the various statutory provisions that would otherwise get in the way of their being on the market. But I think the most significant thing that we should take encouragement from with the NIH study result is that in order for that study to be conducted using human subjects for a clinical trial, they are required to pass a investigational review board, which is a group of independent scientists that would evaluate whether or not the subjects in the clinical trial would be subjected to an unreasonable risk of injury, meaning a safety study. And they passed the IRB. Now, I know that the critics of kratom, not the 7-OH people, the critics of kratom in general, will say, oh, well, that doesn't mean anything because as they criticize the single ascending dose study that the FDA conducted to demonstrate the safety of human consumption of kratom, they'll say, well, that was just a small study, and they will make all kinds of arguments that are designed to minimize the reliability of the safety data that is promoted. And those people are just throwing bombs and trying to make something stick, and it simply doesn't apply in the way that they're trying to make it apply because the critical factor is that this was a determination about human subjects, albeit a small trial, but it's not a drug. And so, not being a drug, you do not have to prove efficacy. You only have to look at safety. And that's the distinguishing difference between a dietary supplement or botanical supplement and a new drug uh, uh, product that's being tested. So we are looking only at the safety factor here as we go forward. And let's not ignore the fact that in 2021, there was an application made by the FDA using a far more lenient standard for scheduling that was made to the UN Commission on Narcotic Drugs. And the evaluation of natural leaf kratom under that lesser criteria internationally was conducted by the Expert Committee on Drug Dependence by the World Health Organization, comprised of 12 independent addiction and drug experts. And they determined unanimously there was no basis for, even at that lesser standard, scheduling kratom internationally. So again, it supplements the argument we're making that there's no basis for anyone to make the argument or to believe that there is an inevitable scheduling of natural leaf kratom. And just because someone tells them that, and because someone throws out their credentials to say, oh, well, this is inevitable, it is not. And it's been proven by the evidence and data that's currently been evaluated by the FDA and by the Drug Enforcement Administration, and it simply isn't a fact. I mean, we can disagree, obviously, but when we disagree and our opinions clash, it doesn't mean that the science goes away, and the science clearly is in the camp of the natural kratom leaf products. So that's the a synopsis of where we are. The AK is prepared just in planning in case things don't go the way that we believe are properly protective of the natural leaf products that we're prepared to litigate, or we're prepared to go to Congress and seek the kind of clarification that might otherwise get lost in the translation with the DEA scheduling rule as they go forward. So I think that can be reassuring to everyone as we go forward. Someone asked me today is, if you aren't certain, then why would you have gone down this path? Well, first, it was not our decision to go down this path. We were perfectly prepared to limit the quality and the safety of kratom products as we did in 2018 when we were preparing for the 2019 legislative sessions. And in that preparation, we devised the Kratom Consumer Protection Act, which put limitations both on the amount of 7-OH that could be in a product, meaning that no greater than 2% of the overall fraction of the alkaloids in the product could be 7-OH. And we had a limitation on extract products where you could not concentrate metrogenine other than using FDA food grade solvents, which limits the ability to extract and therefore increase potency of products. So we have been committed to the safety of these products for a long time. And certainly before the bad actors devised their manipulation of the 7-OH material in the plant and simply made it into the very dangerous opioid products that they are today. So we've been at this for a while. We've been committed to safety of consumers. And I know that there are people that will say, oh, that isn't true. And, you know, that the AK is a horrible group and all that. We have proven it. We've proven it with our actions. We proved it with our commitment to the science. And the fact that these advocates for 7-OH are simply now saying, you've left me high and dry. It was not the AK that did that. It was the 7-OH manufacturers who simply did not give a damn about the safety profile of their products. They, by their mission of Vince Sanders, who is one of the, well, was the leading 7-OH manufacturer when they got on the marketplace, it was he who said, we didn't have any safety data. We just allowed the number of consumers who consumed our products to be the evidence of safety. In other words, using humans as guinea pigs because they're claiming that their product was safe and that all they had was the belief that people could consume it, and they want to use the number of consumers and the number of doses, and they then repeat over and over again that there hasn't been a single death, there hasn't been a single adverse event. That's contradicted directly by the FDA's accumulation of science and validated by HHS. And I can tell you that the last thing that the FDA wanted to do was to get trapped into the same mistake that they made in 2016. And they were far more careful this time around. And they had their own science to back up where they were. So that's the lay of the land, whether anyone likes it or not. That's the way the situation is. And we are committed to protect consumers and, more importantly, to protect consumer access to safely formulated and proper labeled and age-gated naturally kratom products going forward. So I'm going to stop there. If we're going to take 4 or 5 questions, and if you'll raise your hand, we'll recognize you and we'll allow you to have the floor. You do not, and you can ask questions. And we're not going to get into a debate. I think I've articulated the position as best I can. So, David Shelton, you're first up. You can unmute yourself and you have the floor. So, I think you can speak, David. I'm not hearing anything. Is there a reason that we know of why David can't? Have you unmuted? It looks like you're unmuted, David. Is your microphone on? So David, we'll see if we can work on this. Kamal White.
How you doing, Mac?
I'm doing fine, thank you.
Hey, man, just want to say I absolutely appreciate the work you guys are doing. I know we might not 100% agree on everything, but let's be real. You're the one on the front lines fighting to preserve this plant for everyone. So much appreciated.
Well, thank you. I appreciate it. We want to stick to questions, though, but I
Yeah,
appreciate the kind words.
no worries, man.
I'm,
So, okay, my specific question is about where full spectrum extracts fall, right? We're looking at the threshold and we say 1 milligram of 7-OH per, is that per bottle, per serving? And I'm not sure if you guys have done the math with products that are compliant on the market right now, but that threshold varies significantly and is not really, doesn't give good operators much of a room. We could have compliant products today and non-compliant products tomorrow, even if we're not even messing with 7-OH.
yeah, an excellent question. The way that it's worded in the proposed rule, unless they change this, is that it's the article, and the article means, in their mind, we're told that that means the finished product. but that's not confirmed. That was an opinion expressed by someone at HHS that seemed to be familiar with what the DEA is thinking on this. If the article is the entire package, that would limit a manufacturer from having very much material in their package itself. If it's listed as the article being a per serving formulation of the product, then that's a little different. So you're right, but inevitably, I think there's going to have to be some modification by natural kratom leaf manufacturers to make sure that they're compliant. It might restrict the amount of the content. I'm sorry, the content in a package. So great question. We don't know the answer entirely yet. We're hopeful that it's a reasonable standard and that article would be defined as a per serving as opposed to the quantification of volume of product in a package. So we'll see how that plays out. I don't know the specific answer on that accurately.
That could be a very slippery slope, I think, for a large portion of the community. And I worry that if that is not made a priority in the act of trying to get rid of 7-OH, we could harm a lot of people's what the product that they utilize for their life. So I really appreciate you put a lot of focus on that and getting them to distinguish that. I think that is the line in the sand for regulation that is most important when we're making this step.
Yeah, I think that, Kamal, the more important thing is it will change the way that manufacturers deliver a finished product, not necessarily impact the consumer. But we are going to, if needed, address this with legislation in order to correct it if we need to. But thank you very much for that question. It's
Thank
an
you.
excellent.
Appreciate it.
David, let's go back to you to see if we figured out your volume problem. So I think we lost him. Let's go. Who do I have next? Let's say Bobby LeBlanc. You can unmute yourself.
Can you hear me, Mac?
We can, yes.
Hey, bud. Well, thank you again, man. You know, we always fighting over here in Louisiana, but again, we'll talk soon. Listen, quick question. So I noticed they got something on the Congress.gov regarding the publication date of 7/17 regarding like temporary control of 7-OH and related substance under the Control Act. What, and you know, like with Mike Lee's thing and Mark Pocan and all in their bills that's in Congress, what does this have to do to play a role? And I think it's HR 8000 7-OH. But you know the thing that's going through with Congress right now about something
Sure.
about what is that going to play a toll into this, being that it's in the Congress? They got something in Congress right now.
So thank you for that question. The congressional the Congress.gov commentary on the 17th of July was just that. It's a commentary. It was written by an analyst. It's close to being accurate, but I wouldn't rely upon it as the gospel truth. With respect to HR 8000, that is Senator Congressman Bilirakis's. I almost elevated him or promoted him. Congressman Bilirakis's bill that was initially going to just ban 7-OH. It now will become the vehicle for us to make modifications that might be necessary to the scheduling recommendation once we see it. But in its current form, it's already been at least the scope of it's been increased. And so we're hopeful that that will be the vehicle that we can correct any of the problems that we might see in the in the final rule that's published.
So basically, that's like a precursor to kind of like what the KCPA Act did when it started engaging, kind of like a precursor to getting introduced into Congress, basically.
Yeah, exactly. It's just
Right.
the notification that was made. So yeah, we'll work on that. Thank you for
Cool.
the question. I
Thank
think it
you.
was an important
Yep.
one.
Talk
So
to you soon.
David's mic wouldn't work, so he sent it in on chat. What day is most of the industry recognizing this at this point? Is tomorrow the 6th, or is it still legal until the DA official releases scheduling? So the final rule is not effective until it is published in the Federal Register by the DEA, and that could happen any day. It could happen tomorrow or Friday or next week or the following week. We don't know. But the rumor, and that's all it is a rumor, because we've heard multiple false rumors up to this point, is that it will be done Friday. But we're going to watch it every day, and we will alert. At that point, it is the law of the land. There's no grace period for cleaning out products. The people that will be most at risk will be a retailer that has 7-OH on their shelves available for sale, or a distributor that is distributing 7-OH products and the Sudandoxil and MGM-15 products. If they're in the distribution chain and they are identified, they would be at risk for felony charges. And the same would be true for manufacturers that place products into distribution. The DEA is not going to focus on the individual the consumer, but that doesn't mean that some rogue law enforcement guy in the backwoods of Alabama isn't going to do it. So that's why we think that it's important, and it will be in the HR 8000 bill to exempt from these provisions the consumers. And you're not going to get stuck for simple possession. Now, if you have a sufficient quantity for distribution, that's a different issue. But if it's just for your own consumer use and you happen to possess some 7-OH, you're not going to, or these other analogs of it, or the other synthetic products, you're not going to get stuck under the provisions that we're including. We do, at the AK, we do not believe that the individual consumer should be subject to those felony convictions. But we didn't write the law for the Consumer Protection Act. I'm sorry, for the Controlled Substances Act. So we just have to live with it. But we've been reassured by the DA they're not going to be enforcing it, and we're at risk downstream by some of these local law enforcement officials at the state or local level. So there's that. So I don't see any other questions on the federal side. Let's move to an update on some of the hot spots that are occurring around the country. Now, we've got a lot. I'm going to highlight the important ones that I think are on the stove right now, heating up. And if anyone has any questions about a state that I do not cover, then we'll be glad to talk about those. But for now, if I were going to rank them, North Dakota is a major problem for us because, as many of you know, the governor and the attorney general held a press conference on Monday in which they announced that they were going to schedule 7-OH and immediately have the Board of Pharmacy implement the scheduling procedures for it, which, by the way, every Board of Pharmacy in the states where they are authorized to do so will commence those scheduling recommendations or procedures as soon as the DEA schedules and publishes the scheduling. So they will follow suit to do that. But North Dakota is getting ahead of it, and the governor's already instructed them with the support of the attorney general. I would point out to you that every product that was presented at that press conference was a 7-OH product that they had bought from the shelves and identified as the violative products. I think that's important. We had tried last year to get a Kratom Consumer Protection Act, which would have banned 7-OH under our normal KCPA regimen. It was rejected by the legislature, and they wanted to refer it for a study. And then the legislative committee that evaluated the various study proposals dropped the Kratom study. And yet here we are, where the governor's determined it to be of such importance that he wants to suspend the sale of all natural Kratom leaf products for the next 30 some days until he convenes a special session of the legislature. I learned just a few minutes ago that there will be a hearing. We think it's going to be next Wednesday in the Capitol. If that's true, and I have not been able to independently verify it, we're going to need a lot of support from Kratom consumers in the state of North Dakota to be there to address this issue. But as soon as we confirm that, and we should be able to do so tomorrow if the rumor is accurate, then we'll know. But there was a caucus meeting of the majority party in North Dakota on Sunday night where there was a discussion made about whether there should be a carve out for natural kratom. And while there was not a majority view on it, there was at least a substantial number of members that said, hey, we ought to pump the brakes on this, and we ought to look at what the federal government's doing in recognizing that natural kratom leaf, based on the science, should be regulated, not banned, and we'll go forward there. Sort of the prevailing viewpoint among the majority of the caucus members who were influenced by the governor and the AG was that, well, we wouldn't have this problem with 7-OH if we ban all of it. And of course, that goes to the heart of the confusion argument was introduced by the 7-OH manufacturers when they introduced their product and called it natural kratom. And I mean, it's stunning about the problems and the confusion that has created, because market entry for the 7-OH people, which they believed was essential in order to steal the natural kratom leaf marketplace by falsely and deceptively marketing their products as natural leaf kratom. And that now is we're seeing the effects of that with not just in North Dakota, but in many other states where that marketing scheme has come back now to create all of this chaos and confusion in these states that we continue to fight. But we are going to be full bore in fighting in North Dakota to make sure that science does prevail and that we are going to be in lockstep with the other groups, which includes the Global Kratom Coalition and the Botanics for Better Health and Wellness, to make sure that we coordinate our activities to preserve and protect the market access for natural leaf kratom products in North Dakota and every other state that we're going to discuss here tonight where we see these problems cropping up. And that's just the bottom line as to where we are. And I think that I just got a copy of the meeting notice that it looks like there's going to be testimony from the working group for the legislators on the 7th. And I think that's not for public comment, but I think it's the following Wednesday that there's going to be a public hearing where the public can make comments. But we'll verify that and we will send it out to you as soon as we receive that confirmation of that information. I think that we've got the special session in the first week of September, where we're going to need, again, all hands on deck in North Carolina to help us in articulating the reasons why natural kratom leaf should not be subject to a scheduling or a ban order in North Carolina. Second state that I wanted to address is North Carolina. The kratom issue got lumped together with the hemp issue, which is highly controversial in North Carolina. And I think that the reason that the advocates for hemp embraced and subsumed the kratom provisions into their hemp conference report was that they wanted to pick off some supporters who are on our side to try to get support for the hemp. In the end, that strategy backfired on them, but it drug us down with them because the conference report was rejected by the legislature. It likely would have been subject to a veto by the governor anyway. The governor, despite his Facebook post, is not opposed to regulating kratom from what we've been told by our lobbying teams there. And so we're going to be back at the separate and freestanding Kratom Consumer Protection Act when the legislature reconvenes. But in North Carolina, the conference report being rejected means that that bill is dead and that currently the Wild West in North Carolina is what it is, and it will only be subject to the restrictions of the federal DEA scheduling order, which will clean up at least the 7OH portion of the marketplace there, and that'll hopefully give us a cleaner runway to have a discussion with the people in the legislature that were looking at the appropriate regulatory scheme for kratom products marketed in North Carolina. In the state of Florida, the Attorney General, as all of you know, imposed a ban on 7OH last year, and the Speaker of the House, who was not a friend of the Attorney General and who viewed him as a political foe, with the intent of the Speaker of the House to actually run against, at least by some rumors, to run against the Attorney General, a plan that got aborted because of some personal problems that the Speaker ran into related to some personal activities that made his candidacy for Attorney General not possible. But in the state of Florida, the Speaker terms out. And so we will have a new Speaker of the House. We're going to have a new legislature, and hopefully we'll be able to work with that legislature to affirm the Attorney General's new rule, which took place on July 1st. They intend, as we have been told by the AG staff, that they will amend their scheduling recommendation to conform with the federal recommendation. They're listening to us on the potential confusion about the pseudodoxil issue. And then the Department of Agriculture and Consumer Services, FDACS there, will also remove their rule and they will republish. We had some real problems and issues with the FDACS rule that we think they went too far, and we took them to court, and we're currently in an impasse there with an agreement by FDACS that they will not enforce against what we believe are inappropriate labeling rules. And so that's where we are currently. and they've stood down. The FTAX has for at least a moment, and we're going to try to keep their feet to the fire on making sure that they conform with what the federal statute is, and when they reissue their rule, that they're in their lane with respect to what the appropriate labeling of a natural kratom leaf product should be. So that's Florida. The next state is California. Currently, the Department of Public Health has determined that kratom, by definition as articulated in the FDA and kratom webpage, is an illegal product because it is not a lawfully marketed product. We believe that the confusion's been generated by the way that the language is set forth in the FDA and kratom webpage. We have strongly encouraged the FDA to change that website. They have been unwilling to do so, at least until the DEA rule is finally published. We hope that shortly after the publication of the DEA rule that they will make the appropriate changes to that website, and we hope that that will clear up the premise upon which the California Department of Health is basing their current claim about the intersection on their food law to ban kratom products. And so you're seeing a sporadic enforcement that's being made by the Department of Public Health on all kratom products in the state of California. We think it's wrong. We've been arguing with them without much success, but we think that there's both the same situation as on the federal side. We're going to get some clarity, hopefully with the FDA and kratom webpage changes that are made, and if not there, we'll seek legislative remedies. There's a new governor that will take place after the election in January, and hopefully they'll have a more informed view. If it is former HHS Secretary Becerra, he actually has written letters to members of Congress about kratom that would contradict the current Department of Public Health position. So hopefully with a new governor and a new director of the Department of Public Health, we'll have a better opportunity to express our viewpoints and to provide the science that documents the safety profile of kratom in the state of California. That right now it's a problem, and people are just going to have to do the best they can in terms of being able to access a supply of safely formulated and properly labeled and age-restricted products. In the state of Nevada, as many of you or all of you know, the Board of Pharmacy elected after a workshop a couple of months ago to proceed with the full scheduling of metrogeny. And the bottom line is that they have watched what the DEA is about to do, and they have told me, their executive director told me, they've been in consultation with the FDA, and so their plan is that rather than proceeding with the unanimous vote that they got to move from the workshop into a scheduling procedure, that they're going to hold a new workshop to evaluate what the DEA has done and what the FDA's position is, and that will be done sometime in September. And so when that happens, we'll keep everyone alerted. We likely will need support for people in the state of Nevada to testify for us in that new workshop that will be done. Good news there, because they're at least responding to the reality of the scientific information and what's happening at the federal level. In the state of Ohio, the Board of Pharmacy held a meeting on Monday where the metrogeny rule that would ban natural leaf kratom products was on the agenda. And this, of course, was a directive made by Governor DeWine. And they at first folded together the 7-OH ban and natural leaf, and then they separated them. There was litigation that we initiated against them. There was also a separate litigation about some of the combination products. We got an agreement at the AKA's lawsuit with the department or the Board of Pharmacy, where we at least got a little bit more than half a loaf. And now we're going to have to go back and clarify this in a separate litigation that we'll file next week against the Department of Agriculture, because they have widely disparate rules that they're imposing on the sale of kratom products, which are inconsistent with the science, and we're going to be aggressive in that area. But they took no action on Monday night, even though they could have. But I think that the recognition that the legislature based on our intense lobbying efforts there, that the legislature has signaled the Board of Pharmacy that they think that there was a breach of an agreement about how the natural kratom leaf issue would be handled. And I think that there's at least an attempt to resolve those issues prior to moving forward. Good news for us, because the legislature is currently on recess, and we don't want the Board of Pharmacy taking advantage of that breach of time where the legislature wouldn't be easily be able to respond back to it. So decent news out of Ohio, at least at that point. Um, in Wisconsin, and I use this as an example, as all of you know, Wisconsin is a banned state right now, and they have a statutory requirement that says that the Controlled Substances Board in the state of Wisconsin, when they are alerted to the scheduling notice by the DEA, they are required by Wisconsin statute to conform the Wisconsin rule with the federal rule. And of course, if natural kratom leaf is carved out, that would contradict the legislation that was passed by the legislature instructing the Controlled Substances Board, this was back in 2015, I believe, to schedule kratom. And about 2 years ago, the Controlled Substances Board made a conclusion that they did not believe that the 8 factors were met by metrogenine, and therefore it should not have been scheduled, but they wanted the legislature to fix it. But now they're going to be required by statute to act on the DEA rule, and that should trigger a change. And we will be petitioning the Board of Pharmacy. They have a 30-day window for which public hearings can be held, and they make this change. And we will petition them at the end of that 30 days if they're not willing to remove these natural kratom leaf ban in Wisconsin, that we ask them to do so by petition. And then we'll take it up to the legislature if they still don't want to do that. So it provides an interesting opportunity. And I say that it's an example. There are many other states that are in the same boat, including Connecticut, we believe, that's another banned state. And so we're going to be looking at each state where there currently is a ban to see whether or not there's this same language that is present in their state law with respect to scheduled substances in the state conforming with what the federal scheduling recommendations are, and the scheduling of the actual substances that take place. Next state is Rhode Island. As many of you know, Rhode Island was the first state to overturn a ban, and currently there's an interesting political dynamic that's developing there, where there's a strong push to rescind that ban and reimpose it, to rescind the removal of the ban and to reimpose it. And so we're going to be on alert for that. We want everyone who is able to do so to reach out and to make a contribution to Brian Patrick Kennedy, who's our great champion up there. Speaker Joe Shekarchi was another champion of ours. He stepped down from his role as Speaker of the House because he has been recommended for a position, among others, to fill a vacant slot on the Rhode Island Supreme Court. So he's not really available to help, but this will be a significant push by the anti-kratom forces. And so we're going to need to support people like this. And this requires, for those who are able to do so, personal contributions, not corporate, to Brian Patrick Kennedy. And if anyone needs that information on how they can make a contribution, but you can go to just Google it and say Brian Patrick Kennedy for re-election, and you'll be able to see how you can make a check to Friends of Brian Patrick Kennedy to help support him. And we encourage that for you to do that. In the state of Montana, the Board of Pharmacy continues to grind on having a ban imposed. And we, of course, have a legislative Kratom Consumer Protection Act. So we're going back and forth. The principal driver behind the Board of Pharmacy recommendation to schedule all kratom is being driven from Yellowstone County, the largest county in the state, that literally contracts out their health services from the county to a private entity, which is largely an addiction recovery center program. And so they're strongly anti-kratom. And so we have a real fight on our hands there. And we're going to continue to work with the Board of Pharmacy, but we may need help in terms of Montana residents to call in and participate when we have a hearing on that. In the state of Georgia, we have successfully beaten back the repeated attempts by Representative Rick Townsend, who is strongly anti-kratom. And as a result of his latest attempt to ban kratom, he went and appealed to the Speaker of the House to try to get some clearance for his ban bill. He wasn't granted that because the science doesn't support it and because the legislative body wasn't inclined to do it. But he was given as sort of a pat on the head chairmanship of what's called the Blue Ribbon Commission on Youth Exposures to Kratom in the state of Georgia. He held one hearing that was extremely biased in terms of the stacked deck of people that he invited. There were 11 speakers, and I think 8 were anti-kratom and 3 were either neutral or pro-kratom. He will have his second hearing on August the 21st. It is in his home district, so it will be another stacked deck. But here he has said that he is willing to accept public comment. And it's in a remote section of Georgia out near Savannah. And so if there are people in that area that would be willing to help us to come and testify, that would be terrific. And please let us know if that's the case. And that's on the 21st at 9 a.m. to 1 p.m. He has committed there will be some allotment of time for public comments. So we're going to want to have as many people available because he will have his anti-kratom people teed up, including family members who claim that the son or daughter died of kratom or that they were impaired by it. And he's got some examples that he claims that one family had their son placed in a mental institution because of kratom and another that committed suicide because of it. And again, not directly related to kratom, but they try to attribute it as the cause. And so that's something that we're just going to have to fight as best we can. Overarching to all of this, and everyone should have these names on their radar, is that there is a fellow named Dr. Andrew Kolodny. Dr. Kolodny is in my opinion, a straight up shill for the Suboxone and the addiction recovery center industry. He was one of the principal architects of the prescription opioid mess that the government got involved in. He was one of the advocates for restricting the number of prescriptions that could be given to an acute and chronic pain patient because of abuses there. And he capitalized as an expert witness in opioid trials on product liability suits. And after that, became a consultant to state and local governments on how they could get a piece of the pie of the settlements. And now all that's dried up, and he's turned his sights on kratom. He's become very active in this space, and you will see his name repeatedly. We are doing our best to develop the response to the misinformation that he's engaged in. And of course, he has aligned himself with Dean Francis, who has started a group called End Kratom Addiction. You should see the evidence on that. That is simply bogus from Dean Francis's position, where he claims, and in writing said in December of 2025, right before the Virginia legislative session, where he embarked on this crusade to ban kratom, he said in that press release that the kratom industry is upset because his son became addicted to solely and only natural kratom leaf products, not the extracts and not 7-OH. And yet, a couple of months later, he was on a 911 call reporting that his son had shown up at their home with multiple bottles of whiskey, a fifth of whiskey, which he had apparently drunk, that he smelled of alcohol, that he was also on 7-OH. And Dean Francis gave a tutorial to the 911 operator about all of the bad effects of 7-OH and how his son was on it. And there's a truth website that's up that everyone should read that details exactly the misrepresentations that have been made by Dean Francis about his son's tragic experience with addiction and various substances he's on, including alcohol and other things. And it's worth to read because it will prepare us to be able to respond to this kratom disinformation campaign that is going on. So that's just something everyone should be aware of. And we're going to be vigorously fighting back. If you're not on social media, either on X or on LinkedIn, you need to join on and like the post, and to the extent that you agree with them, support the answers that I'm providing to these people because they are active on those websites, and I think it's important. And you know, some of the people are just the cast of characters who strongly believe that 708 should be protected, but they come late to the party in terms of not holding accountable the 708 manufacturers that put them in this position. And they want to blame the AKA and me personally for a crusade against 708, which I readily acknowledge, but it's based on science. It's not personal. And yet they don't seem to understand that. So that's the report on where we are at this point. We will keep everyone posted on the progress of and the date of the scheduling recommendation and the content of that published by the DEA, perhaps as early as the next day or two. And certainly we'll track it if it doesn't happen then to the date that it does happen. And we'll keep you posted on all these other states that we've just reported on. So I'll stop there. And if anyone has any questions that they want to ask, I think we have time for 4 or 5 questions. You can simply raise your hand and we'll recognize you and we'll take the questions. So Nick, you're recognized. So you have to unmute yourself, Nick.
Hello.
Yes.
Hi, how you doing, Mac?
Good.
I guess at this point, my question is, do you think California is a lost cause until the new administration?
Two answers to that. The effectiveness of the enforcement action against kratom sales in the state of California is sporadic at best. And because it is unclear what the basis for the Department of Public Health's position is, there's obviously some room there. But I think that the FDA and kratom webpage is the better remedy because the Department of Public Health has openly acknowledged that they're tying every bit of their current enforcement program to the FDA and kratom webpage. So if that gets fixed, then it's a faster remedy than waiting for the end of the year. But more likely than not, we're looking at the change of administrations before we see any real relief.
Yeah, I mean, I guess the biggest worries is local bans. I mean, there's happening quite often. Do you feel that that would be remedied by like state action at some point? Will there be like preemption of some sort?
Yeah, the great question. It is always difficult to get a legislature to preempt local action. But in this case, because so many jurisdictions have said that they're implementing bans waiting on state action, then I think we have a better argument for preemption than not. And then if we take at their word those localities that say once they get direction from the state, they would align with the state's regulatory scheme. So hopefully that'll give us some relief too.
Got
If
it.
we can
Thank you,
get
Mac.
preemption, we'll get it. If not, we'll have to go one by one. We're batting about 50-50 with the localities and convincing them to ban or not ban. And so we're going to keep fighting there. We have a tremendous local team that works on those things. So David, you're next up. You have to unmute yourself, David.
Hello, can you hear me now?
We can, yes.
Okay. I'm a tea tender in Florida. I'm actually in Bill Arrakis's district. And you know, our approach has been that we think that 7.0 should be part of the conversation. We're adamant, you know, especially at my Kratom bar here that we're not pro 7.0 by any means, but you know this is a big deal for us because we feel that the kind of confusion on everything about being linked in with this being, you know, a kratom issue is a really uphill. It's a pretty big uphill battle, and I was wondering, like, what do you suggest for the conversation as far as differentiating natural kratom leaf from the 7.0?
So a couple of levels of response. Get out of the 7.0H business. There's no room for it.
Right.
It is a chemical.
Right. No, we're not in the 7 business
Okay.
at all.
So the discussion point is that it is a chemically manipulated opioid where a 7-OH product flips the content completely of a natural kratom leaf metrogenine dominant product to a artificially manipulated opioid. So Bill Arrakis gets it. We're grateful that he spent the time to dig in on it. Compliment him for it. But the 7-OH ban is going to take place. There is a pathway that appropriately is before allowed for 7-OH, which they could have taken in the first place if they chose to go the drug path, and that is to go for a new drug application. So that's the best advice I can give. I would support Belarakis on this. He's absolutely right on it, and he dug in hard in order to come to the conclusion that he did about his legislative proposal, and we're grateful for it. And he's going to work on these other modifications we're recommending, some of which he's accepted and some of them he hasn't, but that's part of the legislative process, so we appreciate him. Jana, you're up.
Hi there.
Hi there.
So I'm in New Mexico. They just placed a restriction on sales. And basically, they put that they agree with the FDA on it not being a supplement or it not being sold in a food or as a food, which is correct. I mean, because as an herb shop owner, I don't sell it as a food and I don't sell it in a product, like as far as in a food or as a supplement. Basically, botanical materials is what I do. What is it, or I don't know if you've looked into it or had a chance or even know what New Mexico has done. They have not done a due process, to allow us, to be able to, put in any sort of feedback on the restrictions. They basically just completely stopped everybody to sell. So I'm basically trying to see how I can get help. And I do have the emails that I need to send to get some help. But I mean, what do you think? I mean, as far as us trying to fight this part, because they haven't done the ordinance yet. And it's not an actual banned ordinance here yet, which I'm hoping it won't be. But I'm just kind of seeing what your thoughts on that would be to get them to understand, that this isn't, what, it's not sold as, like as a food product. It's not sold as a supplement. I don't know. What are your takes on all that?
So I had a conversation with the Albuquerque Health Department people, and they were not willing to engage. In fact, were very dismissive, said that I needed to talk to the Attorney General's office. I then made a call there, had a more reasonable discussion. They're relying solely upon, again, like California, the FDA and Kratom webpage. They said that there will be enforcement against what they characterized as the worst products. I don't know what that means to them. It's in the eye of the beholder, but certainly that would include, we hope, the chemically synthesized products. But you're right, it's not an ordinance yet. It's not an official ban, but it's close in terms of regulatory action. So we're going to continue to attempt to work for them. We've been, rather than rock the boat, because I got the sense from the Albuquerque person I spoke to that it wasn't profitable to pursue the conversation, or they would ratchet up their focus on this. But hopefully the FDA and Kratom webpage will be changed. And when it is, and if it is, then we'll be able to go back with a stronger hand to deal with them. But let me know if we can support you as you deal with these local officials, and we'll be glad to fill the gap as best we can. But thank you for reaching out on that. So next we have Wes. You can unmute yourself, Wes.
Okay, Matt, can you hear me?
I can.
Thank you so much. I know that you do dozens of conversations you have to navigate, and nobody really knows what that's like. And if they did, they wouldn't be jealous.
Understood.
Okay, so I think the date was October 6th originally, something like that, where that's when it all ends, absolutely. Unless they end it tomorrow morning or Friday morning. Is that the possibility?
I'm not familiar with any date of October 6th. The scheduling recommendation that was published on July the 6th had the earliest that the DA could take action was on August 5th, which was today.
I
But
remember
they
that.
don't have a time ticker. They can take action anytime they want after this. If there's an October date, I'm not familiar with it.
There was some kind of lock-in date that I remembered, and all of this was preemptive possibilities.
Yeah, I'll
Anyway,
look into that. I'm not familiar with it.
thank you so much.
Glad to. Okay. And then we have Matt S.
Back. Can you hear me?
We can, yes.
I'm wondering, I know that Senator McKell has stated his intention to ban plain leaf next year. I'm just wondering what we advocates could be doing now to try and get in front of that or protect plain leaf.
So you're absolutely right. Senator Mike McKell, for those of you that don't recognize the name, is from the state of Utah. When uh, he has become a national opponent of kratom, and he's aligned with Kratom Danger Awareness, with Patty Wheeler, with Dean Francis, and others. And his whole pitch is to ban kratom entirely. And when he saw some of these recent news reports that he came out and said, "Well, this is what I've been waiting for. We're going to ban kratom." Along the way. We have got a major campaign that we are going to launch in educating the state of Utah about why the federal action should be the guiding principle for state action. And specifically, we're going to identify where Senator McKell deliberately misled the legislature in legislative hearings in violation of his responsibilities as a legislator, and to examine statements that he made in a closed caucus where he reassured the members that he had negotiated with the stakeholders a compromise bill, which is what was passed by the legislature based on his representation, that he had negotiated this deal. We know that he didn't speak to anyone, not a single person on the other side of the aisle that were opposed to him, because we've interviewed all the lobbyists that were involved in it and every stakeholder that I can find, and no one had a conversation with him, let alone negotiated with him on what he claimed and misrepresented to his colleagues was a negotiated settlement. The biggest issue that we see in the state of Utah has been the issue of compliance. And this is a problem throughout the country. When we enacted our Kratom Consumer Protection Acts, there was a general belief that the critical control point would be point of sale. And all states currently have point of sale restrictions for age gating at convenience stores for alcohol and cigarette sales. So adding kratom to that wouldn't be difficult. But when it comes to being able to identify the difference between a 7-OH product and a natural kratom leaf product, that was more problematic for enforcement officials. And so many states just threw up their hands and said, we don't have the money to do it, even though we have a bill. And so I think the combination of federal scheduling, which makes it clears out the shelves of the bad stuff largely, will be important. But we saw in the state of Utah, there was a sale of a product that injured someone that was done under the current law, and that product was illegal. And so it was an enforcement issue. Now, Senator McKell turned down the proposal we made that would have given a 5.4% excise tax equivalent to hemp in the state of Utah. And we think that's an appropriate proportional tax structure for enforcement. And then, of course, they have their registration fees. And we're going to make similar offers across the country to make sure we can enforce against any of this legislation. But Senator McKell is by his own colleagues who have described to me, when they told me about the conversations he had in the caucus, they said, you need to know who you're dealing with. This is a guy who would climb to the top of Mount Everest and kiss an albino yak on the lips if he thought there was a news camera there. And that's his game. He's just a media hound. And so we're going to be engaged in hand-to-hand combat with him on these issues, because we think he materially misled the legislature. We have a Facebook post where he said prior to the legislative session last year that he had interviewed some constituents and he was going to do everything he could legally in his law practice and legislatively. Well, I don't know that he can do that. I mean, but he did the legislative part of it. And if he were setting the stage through legislative work that he was responsible for in order to enrich his law firm with clients, that seems to be a little bit of a problem. So we're going to be working hard with the new leadership in the legislature to see if we can get a fair hearing and fight for a better Kratom Consumer Protection Act rather than restricting it currently to the sale of no extracts are allowed, and they only allow the sale of natural leaf kratom products in a tobacco store, which are essentially vape shops or smoke shops. So we've got work to do there, but we're not giving up. We're going to be in there fighting because we think that the combination of the bias that Senator McKell has and his deliberate misrepresentations to his colleagues about the factual basis and the scientific evidence. Just to give you an example, in one of the hearings, he consumed all of the time allocated for the discussion of his bill by having state agency representatives that he controlled and told to come. And so there was very little time, if any, for a consumer to say anything. But he sat there and made the point to the committee that the FDA dose finding study that one of the members of the committee asked him about, he dismissed it, saying, "Oh no, that was an industry funded research project." And of course, that's not true. And when the representative who asked the questions expressed some skepticism about that answer, he then let the rest of the proceeding go on. And then at the end, he held up his phone to give it validity, to deceive at the grossest level. And he said, "I just phoned a friend and I have confirmed that it was industry funded." Now, I don't know who he was talking to. Was it Mickey Mouse? Because he didn't hear that from anyone with any credibility, because in fact, the FDA dose finding study was funded by the FDA. He just didn't like the results of it. So we're going to be hard at it in the state of Utah. So hang with us, and we'll be letting everyone know the help that we need there. But thank you for that question. Stephen, you're up.
Hi, Mac. I'll be sensitive to everyone's time. We're increasingly seeing remote testimony being used at local and state events. How do we navigate that when we're in our own state but not a resident of the community? And we don't want to step on the other good advocates coming in from other states supporting the people that don't even know this is going on in their community, and opponents piling on from places they don't even know where these cities are on a map. So do you have any guidance about how handed we should be on trying to get, minimize the effect of, these remote voices versus potentially promoting them, I guess is what I'm trying to get after.
Sure. Great question. So my recommendation is this: be there no matter what. And then read the room. If you hear these anti-kratom voices that are from everywhere around, these are the typical KDA people. Obviously you want to fight back on the same ground that they are operating from. But if you sense that there are enough advocates in the room from the local community, all you have to say is, "I support protecting natural leaf, and I'm going to defer my time to the local people in the room," because the KDA people aren't going to do that. And that will give you some cred. So I think it's just a question on a case-by-case basis to try to read the room and see how the hearing's going. We do well. We just had St. Joseph, Missouri, where they converted the ban to a regulatory scheme. We had the same thing happen in California in 2 locations. So we're losing some, obviously, because it's a difficult, emotionally driven kind of program, but we need your voices there. So stand up and be there if you would, and just read the room when you get there. Tori, you're up next. You have to unmute yourself. We still can't hear you, Tori. So let's move on to Steve, and we'll come back to Tori if she can figure out how to unmute herself. Steve, you're up.
Hey, man. How's it going?
Good.
So locally, we just had a city ordinance in Wabash County, Illinois, where they have banned the sale of any kind of kratom products, including natural leaf. And they explained at a city council meeting that the natural leaf product is currently the subject of legal and legislative challenges because some group argue it has legitimate medicinal uses, but they think that there's going to be a complete ban. So just a quick question is, have you heard any rumblings out of anywhere in Illinois that are talking about a ban on natural leaf and 7-0?
So our sponsor is the assistant majority leader in the state of Illinois, and his name is Marcus Evans, and he is the outgoing president of the National Conference of State Legislators. And we were at the legislative summit meeting in Chicago last week, and I spoke with him directly on this issue. He's struggling with the governor's office, who's being influenced by the Department of Health, who wants a ban. But the legislature is not going to let that happen. They want there to be obviously a regulatory scheme put in place. So we discussed some strategies on how we can get in front of the governor's staff, which he's pursuing. And we think once we get that opportunity, we'll be able to explain why the Department of Health is wrong. But you are accurately hearing from these local governments where they're looking for guidance and getting none. And the only thing they're hearing is from the Department of Health. So we're going to hopefully get in the middle of that communication channel and to have a better communication with them. So stand by for an update on that. The Marcus told me that he would have that conversation with the governor's office here in the next couple of weeks. Might be difficult over August, but we'll see. But certainly by the first of the month, and then I'll be able to report back. So Tori, it looks like you're able to unmute yourself. So you're up.
Yeah, my apologies.
That's all right. That's all right.
Does the North Dakota ban create any legal precedent or kind of momentum that maybe could influence neighboring states like Montana? See, I'm on the border of North Dakota and Montana, and you had mentioned Yellowstone County. Do you think that's the first step towards statewide regulation, or how can we stay ahead of it?
So just be engaged. There's no official precedent setting for one state or the other. Every state gets to decide on their own. But certainly, if a neighboring state does something, I mean, South Dakota passed the KCPA. That hasn't influenced North Dakota,
Right.
at least at this point. So it's a case by case approach. We don't like losing states. We don't like the precedent that's set in losing a state. But we're going to be in hand-to-hand combat both in North Dakota and in Montana. So join us there on the appropriate state where you live in, and let's make sure that we prevent these bans from being actually taking place.
Thank you.
Thank you. Okay, I think that's the end of it for the question and answers. Anyone that has an additional question that you want answered, just shoot us a message and we'll be glad to do it. We thank everyone for joining us this evening on this webinar. We know that there's a lot happening. It's easy to get confused. There is chaos reigning, as we all know, between the conflicting groups. And I know there, as I mentioned earlier, there's impassioned advocates for 7-OH. I understand it. I think that they just have to consider how this problem got created, and that is at the hands of the people who introduced these products in the market failing to follow federal statutes. And that's the bottom line. And they can talk about, oh, well, forget about them. That wasn't my fault. Right. But they're the ones who provided these products that are violative of the federal statute, and which is why they're going to be scheduled. And we are sympathetic, and we will do all we can in order to protect individual consumers, but none of those consumers should be on these products. And so it's not as critical a factor as we might otherwise think, but we don't want people to get trapped in felony convictions, obviously, and being incarcerated in this particular situation. So please be cognizant of that. I see Misty raised her hand. I'm going to let her be the last comment or question, and then we're going to let people go. So Misty, you have the floor.
I just wanted to ask, can you do an update on Kentucky? And don't forget about the September 13th rally.
Thank you. So, Kentucky, the the Kentucky statute as it reads today is that kratom will be banned effective July 1st of 2027, which means that we have the legislative session, the opportunity to be able to pass a KCPA in Kentucky rather than a ban and strengthen KCPA because we already had one. But the governor's complaint about the KCPA was there was no money provided by the legislature to enforce it. And so he felt like he was trapped when the legislature gave him this ban bill, which was an amendment to a revenue bill at the last day of the legislative session. And that's a whole story that's not worth going into, but we're stuck with that. So we'll have the opportunity to go through a legislative session, regular order with committee hearings, and we're going to need everyone's help in going forward on that. So that's the answer on Kentucky, and another issue that we'll keep you updated on. On September 13th, which is the 10th year anniversary of the rally that was held outside of the White House on Lafayette Square, we are going to hold a recognition event. It will not, unfortunately, be we're not able to use Lafayette Square because of construction around the White House, but we will have an alternative location close to the White House or close to Capitol Hill, depending on what the permitting does. And we will then have a recognition of that, the initiation of the grand fight that led to the withdrawal of the federal scheduling notice, the first one before since that has occurred because the science didn't justify it. And we will then, in conjunction with that, have a series of events on Capitol Hill, and we will have a roundtable discussion before the House Veterans Foreign Affairs Committee, where there will be a presentation on the value that kratom has had for veterans that are dealing with acute and chronic pain issues. And so this will be a grand opportunity for the kratom community to participate in meetings on Capitol Hill, in some planned events that we have associated with members of the administration, and this hearing, this roundtable discussion with the House Foreign Affairs Committee. So everyone should try to schedule it. What we're asking people to do in the advocacy side of this is to reach out to your network of friends and family and see if you can raise the money that gets you plane fare and lodging to get here to DC to participate in this event. All hands on deck are welcome, and we would appreciate your being able to do that. And encourage you to do so, because this will be a media event in addition to being a great recognition of that effort that started in 2016, where we were able to actually start this rebellion against the overreaching authority of the FDA, who at the time believed that kratom was schedulable under the Controlled Substances Act, which we know it was not. Which they were giving their comeuppance by none other than the Assistant Secretary for Health, Dr. Brett Giroir, who classified or characterized the 8-factor analysis they presented as embarrassingly poor evidence and data. And that, of course, is going to be the theme that we carry forward to today, where we know that the protection of the natural leaf kratom products is essential. So we're going to want to spread out on the Hill with Hill visits to members' offices, because this legislation will be considered and as we lead up to the end of this session of Congress, and there will be legislation that will be under consideration, including during the lame duck session of the Congress, that will impact kratom. So thank you, Misty, for reminding me of that, and stand by for more information. But everybody, please make arrangements to join us as best you can. Thanks to everyone for joining us tonight. We look forward to future communications. Stand by for us alerting to you to the next events that are coming up. Thanks so much.